Good day to you. Today we are talking about dental caries. First of all, we will discuss the structures of a natural tooth. The outer layer of the tooth that is seen from outside is called the enamel. That is the toughest part in our body, which is having lot of minerals and very strong. Underneath which is the yellowish layer that is shown there is the dentine. Dentine is not as strong as the enamel that we spoke before. It is porous and it can pass through some acids and damaging substances to the pulp tissue, which is at the center where you get the nerves and blood vessels. You see the three-dimensional view of this tooth. The outer blue colored thing is the enamel, which is the strongest part, underneath which you get the dentine, which is porous and less strong. It can wear off, dissolve off very easily. Underneath the dentine, in the center of the tooth, you get the pulp. Pulp tissue is very sensitive. You get nerves, blood vessels and other structures there. So we have to be very careful in preserving the enamel, which is the most resistant structure of the tooth. If we preserve the enamel, the acids that are produced or any other insult will not go and damage the pulp tissue. If the insult is going into the pulp, the innermost soft tissue, you will get pain. In nature, you have a natural 32 teeth in your dentition. But if you don't preserve them, you get bacteria working on them, getting deposited over the surface, and they will produce acids which will slowly dissolve the strongest part of the tooth or the body. But in nature, the natural salivary flow will wash them off as a natural process. But if you have some disease like diabetes, this natural flow is reduced because your salivary flow is less. Then you get cavities. Also, if you continuously leave this sugar to collect, they will be a good substrate for the bacteria to come and work. Once the bacteria grow there, the acids are produced. These acids will dissolve the enamel, then the dentine. You can see they are affecting the dentine. Once it goes to the dentine, it is sensitive. Once it goes to the deeper parts, the nerves are embedded, you will get severe pain. And ultimately, you may have to extract teeth. You are suffering. But the most important thing is to preserve your toughest part of the tooth, that is the enamel. Once the enamel is damaged, it will go very easily to the deeper structures, that is the pulpal tissue will be very easily affected and you will get pain continuously. So if you get a cavity in the enamel, you don't usually fill. You can just brush that area and clean nicely. But if the cavity is extending to dentine, the underneath part, you can do a good cleaning and then fill it up, as you can see in this diagram. There you can easily fill with better materials in modern technology so that you can get the natural shape of the tooth. To mind you, anyway, none of these tooth filling materials are as good as your natural tooth structure. So make sure that you don't get cavities. Filling is expensive. Filling can replace your missing part, but it is a second-hand, second-class sort of a thing. So try and preserve the tooth, but keep in mind, if it is in the dentine, we can fill them to the original level of the tooth. This is a light cured filling. You can see the light there, and ultimately we are getting into the natural shape and structure which can be maintained in the long run. But most importantly, what we all know is to brush your teeth very well. You have to brush in the morning and brush in the night, both after your meals. More importantly, you have to reduce your in between snacks, in between sugars. And if you want to have something we always recommend you to have fruits that will not cause you dental decay. And having fruits after a meal would prevent getting this decays collection of sugar, and on which the bacteria will cause decaying of the tooth. But some people, they used to have snacks in between which contain sugar. Not only the sugar I am talking about, the cakes, this other snacks which contains lot of sugar, which will stick onto the tooth, and you will ultimately get cavities by the action of bacteria that we discussed before.